Hi guys, it's Nurse Tiff and I'm back with another video. So this video is a continuation of the sequence of videos that I've been doing to catch you guys up to speed with what's been going on with me. In prior videos, I talked about me finishing up nursing school, me graduating, me preparing for NCLEX, me passing NCLEX, me preparing for jobs until me actually obtaining a job. So in this video, I'm gonna talk to you guys a little bit about my experience with my first 3 months as a new grad nurse on my unit, which is a cardiovascular thoracic heart, lung, and transplant unit. So let's begin. So I started working as a new nurse in February of this year. When I started, the first initial 2 weeks were online. So the online portion consisted of us doing like regular modules that you would do probably at any healthcare job. So the trainings involve things like sexual harassment in the workplace, your scheduling, learning how to work the charting system, and things of that nature. So that typically took us a couple of days to do and to knock those videos out. And then the next part was specific to the unit that I'm on. So this was training specific to the left ventricular assistive devices that we deal with, TR bands, anything from chest tubes, dressing changes, anything from working the IV pumps to the acuity on the floor, knowing how to check for things like if a bed is available, how to transport a patient, all of those different things was in the second half of the training. So once we completed everything that was online, it was time to transition to in-person. So it was days that we had to come into the hospital to do live demonstrations where we would have someone and they would show us these devices and they would show us how to troubleshoot them, show us how to work them, and then we would have to do a return demonstration. And that's just so when we got on the floor, we would be comfortable enough knowing how to work these devices, or if we didn't know how to work them, we would know how to find the information on how to work them. Or if we needed to ask questions, then we wouldn't be oblivious to what it actually is. So that was pretty helpful to have the live demonstration. So once we moved from that, that was like the first mainly like 2 weeks, 2.5 weeks or so. And then I went to the floor. So when I got to the floor, I had 2 preceptors. Yep, 2. So both of them were like nurses with like 20 years of experience. So they were kind of like the most knowledgeable nurses on the floor. Now, some people would say that this is a good thing, but it can be a good or a bad thing, and I'll explain how. When you have 20-year-old seasoned nurses in their training a newbie, they are used to doing things their way. So you have to get used to doing things their way. But then when I'm switching off and I'm with the other preceptor, then I have to kind of like forget what I learned with the other preceptor to do things the new preceptor way. So I did find that a little bit frustrating for me, but nevertheless, it was a good experience. So my preceptorship lasted for, I would say maybe 6 weeks with both of them on the floor full time. I just would rotate based on their schedule. If one wasn't there, then I'll be with the other one. So basically the first couple of days I shadowed them, and that was for me to get familiar with the floor, the patient load, to see how they handle things and how they care for the patient. So I started off after the first couple of days, I got 1 patient. So once they saw that I was able to handle that 1 patient, then they gave me 2 patients. So then I would care for these 2 patients. So then after I got the flow with the 2, they would add on a 3rd patient. And then once I felt like I could keep up, then they gave me a 4th patient. So eventually I was gradually, progressively working my way up to the normal flow of patients that we would have on our floor. Because my floor has a higher acuity, we have anywhere between 3 and 4 patients. Now, if we're super short staffed, we may have 5. But it's very rare that we have 5. We typically range from 3 to 4 patients. So when I had these patients, I wasn't necessarily 100% comfortable with gradually getting new patients because I was still learning as I was trying to care for these patients. And I had a lot of pressure from my preceptors for me to kind of like make it click and make it stick. But it was like when you are a nursing student and you transition to like a real nurse, it's a barrier that you have to cross to kind of get out of that nursing school mindset to be able to critically think as an actual nurse. And then the speed at which I was learning was so fast that I felt overwhelmed all the time. I felt so flustered. No matter what I did, I just had so much anxiety. And I had anxiety before from nursing school, but actually working as a nurse and having people's lives in your hand, it just made my anxiety that much worse. But nevertheless, once I got to like the 7 week of training, both of my preceptors felt that, you know, I was in a good enough space to where I was a safe nurse and that I was okay with working alone. I didn't feel like that, but the nurse educator agreed that I was in a good space to be able to work on my own, and management agreed too. And I don't know if that had anything to do with them just needing a nurse on the floor, an extra nurse, versus, you know, the two preceptors taking their time out to cater to me, or if it was naturally that I was doing well. I trust that they felt that I was doing well. I just wasn't confident enough in myself at the time. So after that 7 week, the 8th week is when I really like got a full patient load myself. So it kind of went pretty good. I still felt that anxiety. I still felt flustered, you know, but I was just reassured that that was just something that was natural that every new grad nurse feels. You feel pressure and anxiety for caring for people. You feel anxiety because you fear you're going to do something wrong. You feel anxiety because you may not move at a faster pace as other nurses. You feel anxiety because you may feel behind. Like, you can have anxiety for a number of different reasons. I had all of those reasonings why I was anxious. And it's just something that you just have to literally like work through and tell yourself that you made it this far and you will be okay. It's something that you just have to take day by day. And so that's just what I did. So when the 3rd month came around, I felt that I was grasping my job and I knew the flow and I knew how it operated, and I was a little bit more comfortable with doing my role and doing my job. So that's a little bit how the first 3 months went for me. It was mainly just training and learning the job, and getting comfortable with just being a new nurse altogether. When I would leave work and I would feel overwhelmed and feel flustered, I would just do things that were unique to me, that made me happy, like working out or going out with my friends, or, you know, going out and pampering myself by getting my nails done or my hair done or something like that, to kind of like offset the stress that I would experience during the first 3 months. But it turned out that, you know, I just experienced what every new nurse experienced, and I'm no different from everybody else as far as those experiences. But that was kind of like how my first 3 months went. So I won't drag this video any longer because it's kind of long, but let me know if you guys enjoyed this video. If you have any other topics you want me to discuss, don't hesitate to let me know. Until next time, guys, I'll see you. Bye.